Okay, it looks like we have a few more people who are joining, and I imagine that will be the case even as we kick off, but I want to make the most of the time that we have this evening, so we'll get started and know that we may have some others join. Um, Thank you all for being here. My name is Becca Steinhoff. I am the Executive Director of Wyoming Kids First, and wear several other hats in this early childhood and youth space in the state of Wyoming. I'm delighted that we have the opportunity to gather tonight for this webinar and conversation. So for those of you who have come on in the last few minutes, you'll notice that this is structured differently than some of the other Zoom calls that you may have had in the past. That is because we had so many people RSVP and register for this event that it is structured more as a webinar than a conversation. So what we'll do is have you join the conversation by using the chat box. So you won't need to use your webcam tonight, so the pressure's off for that. And we'll just look forward to hearing from you and watching conversation in that chat box. Those of us that you do see on the screen are a part of the panel and moderating team for this event. And so Wyoming Kids First is very much pleased to partner with the Wyoming Afterschool Alliance, Michelle Sullivan and Kate Foster, and the Wyoming Community Foundation. We have Samin Dadalahi on as well. So lots of individuals who are in that support role. And then we have two other key guests with us tonight who will take a strong role in presenting and answering questions. So we have Dr. Harrist with us, who is the State Health Officer from the Wyoming Department of Health. Many of you have probably watched her speak and heard from her before this moment. And then we are also really pleased to have with us Stephanie Pyle, who is the Senior Administrator from the Public Health Division at the Wyoming Department of Health. And these two women and their teams have made some extraordinary decisions for all of us in Wyoming over the last few months. And so it is a gift of their time to be able to engage like this this evening. And so what we envision for the night is taking some time here for the Department of Health to do just an overview of the current guidance for childcare programs and provide us with a starting place for some of this conversation. And then we'll go ahead and move into that question and answer session of the evening. We will adjourn no later than 7:30. So if we continue to have questions, we'll be sure and monitor those. If all of the questions are not able to be answered this evening, we'll be sure that we continue to work together and get answers to as many questions as we can. And in that spirit, I would also just say that we know there is a lot of ambiguity and uncertainty and tension during this time, but let's use this opportunity to please be kind to one another and focus on solutions and getting guidance and answers to the questions as we can. I see that Lachelle Brandt is joining us. You'll see her name on the screen now. Lachelle works in the governor's office, and so we're delighted to have Lachelle on here as well. So thanks for joining, Lachelle. We're just getting started. So we'll go ahead and move into that portion of the evening where we'll hear from the Department of Health. They can do an overview, and then again, we'll move into question and answer. So we'll ask that you use that chat box again for the Q&A, and we'll keep an eye on that and help our panelists and question answerers to stay on top of the questions that we're sure will come in. So thanks again for being here for all of our 97 attendees, and we'll just get started now with the presentation. So Stephanie, you can share your screen and go forth.
Excellent. Thank you so much, Becca. Becca, can you just confirm that you can hear me again? Awesome. Thank you very much. So I'm going to share my screen. Can everyone see my screen right now? Okay. So I am so pleased to see such a large number of people on the call this evening. I am just really pleased that you're here. I'm going to try to multitask and share my screen as we get started. I really want to say thank you first and foremost for the work that you do in our state. Your work is critically important to the state operations on so many levels, and the value of a good child care provider is something you can't put a price tag on. And I know from experience, having 3 children who have at one point or another been in childcare themselves. So thank you all very much for the work you do. I appreciate it. To sort of set the stage for what we'll be talking about tonight, I want to just sort of give an overview of kind of what we do and how this looks in our world. And I'll share some statistics with you, but just to kind of put things into context, you know, as this pandemic started at the beginning of the year, you know, I don't think that any of us really fully were prepared for what was, you know, what we were about to face. And with that being said, we do have a preparedness unit that really focuses on being prepared for public health emergencies. And we oftentimes practice our pandemic flu plan, for example, or do other exercises to prepare for things like this. So our division really spans through a wide spectrum of duties that pertain to a public health emergency. And so as we do that, we have our preparedness staff, we have our epidemiologists, we have our state health officer who plays such a critical role in all of the activities that we carry out. And we're pleased to do that on behalf of the state. You know, with this pandemic, you know, I know that everyone is aware of this, but, you know, these are unprecedented times, as I'm sure you've heard many times before. So we are working through this, keeping, you know, public health in mind and trying to protect public health, and yet trying to balance out a number of other factors that we're all facing each and every day. We've had the true pleasure of working very closely with the governor's office throughout all of this and doing our best to keep the public informed, county personnel informed, legislators informed, and really trying to walk through, you know, with our sister state agencies to make sure that we're doing our very best to keep information flowing. And as you all are likely aware, you know, this information changes so rapidly. And during some, you know, circumstances, what is a given one week might be different the very next week. And so we, you know, have done our best to try to walk through that and to try to provide Wyoming residents with the support that they need. We've been very pleased to work closely with the Department of Family Services throughout all of this. The director of the Department of Family Services is actually a former Department of Health employee. She was our deputy director in addition to some other positions she held. So we are very appreciative of the close working relationship that we have maintained and have on an ongoing basis with Department of Family Services. So I just wanted to share a little bit about the statistics that we currently have. And for anyone interested, we have a robust set of data on our website at health.wyo.gov. But just to give you a brief overview of kind of where we stand today, we have 760 lab confirmed cases and 210 probable cases. As we go through the evening tonight, we'll try to define some of the terminology that may not be as familiar to some. So a probable case is an individual who has been exposed to a lab confirmed case and who has symptoms consistent with COVID-19. So when you look at our website, that's the distinction you'll see between the lab confirmed cases and the probable cases. So our total case count right now is 970. And of those, we do have 600 lab confirmed cases that are recovered, and for a total of 789 recovered. So, you know, we are pleased that we have so many that have recovered, and we've worked really hard with those who've experienced COVID-19, you know, with our epidemiology team to really stay in touch with them, talk to them through their process, give them guidance and assistance throughout what is likely a very scary time for them. Unfortunately, we do have 17 deaths in our state as of today. And so we obviously continue to monitor all of those cases on an ongoing basis. You may have heard a lot about testing over the past several months. And we have our public health lab, which sits within our division. And the total resulted tests for our entire state is 30,126, with our public health lab contributing to about half of those. Our public health lab staff has really gone from basically operating as an 8 to 5 operation to essentially operating from 7 in the morning until 10 o'clock at night, 7 days a week. They've really just stepped up in an amazing way. We've had some extra personnel who have come on board from the University of Wyoming to help, and we've hired some temporary staff as well. So, we have done a lot in the way of testing. Obviously, there's more to do, and we continue to look at ways that we can make that testing more robust in our state and continue to grow that. We are fortunate in that only 3% of our tests have been positive out of that larger number that I gave you. And so, we feel that that's a positive place to be right now. One of the things that we also continually monitor, and as you look at our numbers, you might say, those are pretty low numbers. And, by comparison to other parts of the country and the world, that's certainly true. We have to keep in mind our hospital capacity as well. And so we've kept a very close eye on that as we've gone through, making sure that we are not getting to a point where, our hospital beds are no longer available. And not only do we have to keep it, in mind the COVID positive patients who may require hospitalization, but also all the other patients who may need hospitalization for other reasons not related to COVID-19. So we've worked really closely with our hospitals and our hospital association here in Wyoming to keep a good eye on those things to make sure that we're not having any cause for concern. So in advance of the webinar tonight, Becca shared some questions that have come up frequently. So what I've tried to do is incorporate that into the presentation, and then any questions that we haven't caught along the way, certainly please feel free to put those into the chat, as Becca mentioned. So one of the questions had to do with what are the symptoms? And so this comes directly from the Centers for Disease Control. And I'm sure as most of you have watched, or as all of you have watched the news, you know that the symptom list has sort of transformed over time as we learn more about the virus. So you'll see the first few symptoms here: fevers or chills, cough, shortness of breath, or difficulty breathing. And as you may recall, from the earlier months, this list has really expanded to the list that you see here now, to include fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. And so, as the CDC indicates here, the list does not include all possible symptoms. And this is an ongoing, range of symptoms that the CDC continues to monitor. And they do provide updates on their website quite frequently. We'll get into this more later, but I do want to note here that in the guidance that you have and the order that you have that pertains to childcare facilities, it does include guidance, screening for staff and children. And so we do have a screening tool that's available at our website at health.wyo.gov. So another question that came up has to do with what happens at the local level, what happens at the state level, and how does that interact? And so I'll just take a minute to share how our structure works and why you may be seeing some differences from one county to another. So the Public Health Division oversees public health nursing work throughout the state, and we have a centralized system that operates, and really counties have three ways of operating. And it's been this way for some time. We worked on legislation related to public health nursing many years ago. I think about probably 5 years ago, we finalized the system. So counties have the option of operating in one of three ways. And so essentially 19 of our counties operate with local public health nursing offices, and the other 4 counties operate independently. So what that means is that in 19 counties, we have state employees and county employees who are really working side by side to carry out those public health efforts. And in the other counties where they operate independently, it's all county employees, but we do still have a working partnership with them to the extent that we can contact them at any time. They can contact us. We really work very closely together on public health issues, staying in touch with the staff there in the event of an outbreak or other public health issues that we may be working on when we're not in the middle of a pandemic. But certainly, regardless of the system that's in place or the model that a county has chosen to work under, we're working closely with them regardless. It's just a matter of sometimes there are state employees, sometimes they're county employees, but the work is still the same in terms of staying in close contact and dividing up that work. So for some of the larger counties, they have been able to assist in our efforts with contact tracing. And really what that means is that when we learn of a COVID-19 positive individual, our epidemiologists reach out to that individual and really talk through, who have you been in contact with? Who have you been in contact with before you were symptomatic, and who after you became symptomatic? And in an effort to really slow the spread, reduce the spread by reaching out to those other individuals. And we'll talk more about this in a few slides, but to really get a handle on who may have been impacted and who might need to take measures to further prevent the spread of the virus. So that's why you may see things different from one county to another, where you may see state employees reaching out to do this contact tracing, or you may see county employees doing the same. So, as I mentioned earlier in my presentation, things change very rapidly. And so, as you know, child care providers are currently operating under provisions related to order number 1, the first order that was issued, that's been continued 5 times. We're getting ready to issue the 6th continuation of this, and there are some key changes for child care facilities that have recently come up that I want to share with you. And when I say recent, I mean yesterday. We really are working at a very rapid pace. So the upcoming changes to the order will take effect on June 15th. And some of the key changes that you will see have to do with the restriction of 25 people in separate rooms for child care providers. That restriction will be lifted. And, essentially what we're envisioning is that child care facilities can, get closer to resuming normal operations. There will still be some provisions that will remain in effect, which we'll talk about. But the number 1 change has to do with that restriction. And then the other change has to do with pickup and drop off. We did receive feedback about some of the difficulties that presented. And certainly, one of the things we've never wanted to do is to make it difficult for entities to operate in a manner that they need to. And yet we do try very hard to work on protecting public health as we implement these different orders. But the provisions regarding pickup and drop off are changing. And I'll tell you what the new provisions will say. Individuals dropping off or picking up children must stay 6 feet away from children that the individual is not dropping off or picking up. Meaning, of course, the parent can go to their own child and pick them up or drop them off. But that we're trying to really make sure there's no contact between that parent and other children that are not their own. We feel this is another important measure to reduce transmission and to keep people protected. So the provisions that will remain in effect include the hand washing upon arrival that I'm sure you're all familiar with from the order and the guidance, screening of staff and children upon arrival. And again, I mentioned that screening tool should anyone need that. A record of staff working hours. So in the event of a positive case, we know who to contact. Closure of the facility in the event of a confirmed case within the facility. And Dr. Harrist will talk more about that in a moment. And then of course the cleaning and sanitizing. And so those are the provisions that will remain in effect. The orders will be released tomorrow and again go into effect next week through the end of the month. So I'll move on now to the next slide where we'll talk a little bit about cleaning and sanitizing. And one thing that I want to mention here, as we work through all of these different issues, we become aware of some of the difficulties or some of the disconnects that might exist within our systems. And as a result of that, we really take that feedback to heart and make changes, to the very best of our abilities. And so one issue that we became aware of with regard to cleaning and sanitizing is that perhaps the guidance wasn't always the same from one county to the next. So following this call, we'll be putting this out to our local offices and to our local health department partners to, to indicate that we've had this webinar and that we've gone over these, this guidance so that everyone can be, kind of on the same page in terms of information that, that would be helpful to child care providers. So with this, I'm going to turn it over to Nikki for a moment from DFS, if Nikki is on the line, to talk a little bit about the DFS portion, and then we'll turn it over to Dr. Harris to talk through some of the resources and recommendations. So Nikki, are you on the call?
I am.
Great.
Thanks, Stephanie. Good evening, everyone. I'm Nikki Anderson, the Licensing Program Manager for DFS. And I want to echo what Becca opened with and extend a big thank you to Dr. Harrist and Stephanie for making themselves available tonight, for Becca and Nichole hosting, and for all of you for joining in. I know it makes for a really long day for you all. The childcare licensing rules require that when chemicals are used for sanitization, a test kit or other devices that accurately measure the parts per million concentration of the sanitizer shall be provided and used. The local health inspector and or the Department of Ag provide guidance on the appropriate ratios when using chemicals. And having said that, I want you to know it's important to recognize that our licensing rules are minimum standards, and that during this pandemic, the Department of Health and CDC have guidelines and recommendations that really should be put into practice. So our rules, while they're minimal standards, don't allow for a higher standard during this pandemic. I think that it's important for you all to, and I think what Stephanie just said is critical to this conversation, that this information will go to all the local public health offices. And if you have questions or concerns about how things may be going in your program and what you can do to ensure that you're following the guidelines and recommendations, I would encourage you to reach out to your local health inspector or local public health office.
Thanks, Nikki. Dr. Harris, we'll turn it over to you.
Okay, does that work? Can everybody hear me? Okay, great. Yes, I'd like to echo what was just said, that essentially, you know, the cleaning, sanitizing, disinfecting procedures for coronavirus should really be similar to what you're already doing, but more frequently, essentially, and you know, likely multiple times a day for certain types of objects, especially objects that are going into kids' mouth, which, as we all know, happens quite a bit in kids of certain ages. CDC has pretty good guidelines on COVID-specific disinfecting, sanitizing, and cleaning. We've provided the links here to CDC guidelines. CDC then again does link to a Caring for Our Children document, which probably many of you are very familiar with, which walks through a lot of the specifics about, you know, a cleaning schedule and which specific products you should use. In general, most of the common household disinfectants and sanitizers that you usually use are effective against coronavirus. This is not a particularly hardy virus, unlike norovirus, which you know, requires more specialized cleaning. CDC has a list of all the disinfectants and sanitizers that are approved to combat coronavirus. You'll recognize a lot of them, as well as, you know, specifically how you should use them according to what's recommended for other types of pathogens. CDC's guidelines talk about regularly cleaning and disinfecting surfaces that are high-touch surfaces. So this might be more than you usually do. So things like doorknobs, light switches, desks, chairs, etc. So at least daily, potentially more, both cleaning and disinfecting, and then cleaning and sanitizing objects that are going into kids' mouths, like toys or plates or utensils, and ideally cleaning and sanitizing, you know, after they go into each kid's mouth, which I know can be difficult, but that would certainly be the ideal. We did get a specific question about whether outdoor play equipment should be cleaned, sanitized, disinfected. CDC has a specific answer for this. It's a question that they've gotten a lot. What they say is that outdoor areas generally require normal routine cleaning and do not require disinfection. Spraying disinfectant on outdoor playgrounds is not an efficient use of disinfectant supplies and has not been proven to reduce the risk of COVID-19 to the public. You should maintain existing cleaning and hygiene practices for outdoor areas. If practical, if high-touch surfaces are made out of plastic or metal, like grab bars or railings, those should be cleaned routinely. But cleaning and disinfection of wood surfaces or ground covers like mulch or sand is not recommended. So hopefully that's helpful. There is a lot of specific guidance out there. We are happy to answer specific questions to the best that we can. There is also guidance from CDC if you are using bleach to sanitize or disinfect about what the recipe is for that. It's 5 tablespoons or 1/3 of a cup of bleach per gallon of water, or 4 teaspoons of bleach per quart of water. And again, that's on CDC's website, but we can also send out those specific numbers as well. So I think I'll end there, and of course, happy to take any questions about this later on. Moving on, we've also gotten a lot of questions about what happens if we do diagnose a case of COVID in the child care facility, whether it be a child or a staff member. So I think to begin with, I'll just talk about in general give a little bit more details to what Stephanie started talking about, what happens when we identify a case of coronavirus. And that's really the contact tracing, isolation, and quarantine that we've been talking about, throughout this whole outbreak, and which are extremely important measures in preventing transmission of COVID, and will be extremely important going forward, especially as many of the restrictions are easing in the state. So all laboratory results are reported to us. When we see that a positive COVID result comes in, we contact that person as soon as possible, and as Stephanie said, do a really thorough interview to see who, first of all, where they potentially might have gotten it, so kind of things that they've done since in the couple weeks before their symptoms started, but also who they've been in close contact with while they were having symptoms or in the 48 hours before they started having symptoms. Certainly if the case is a child and can't do an interview with us, then we interview the parents instead. Anyone who's a confirmed case, so has a laboratory result that says they have COVID-19, is placed in isolation. Isolation is the separation of an individual from other individuals when they have a known contagious disease. The length of the isolation period, you can either define that 2 ways. You can either use symptoms, which is what we use in the majority of cases, or you can use lab testing. But essentially, you remain in isolation until you're considered no longer infectious. So you have to stay home and away from others until you're no longer infectious, which is at least 3 days after your fever has resolved without any fever-reducing medications, and your respiratory symptoms improving, and it's been at least 10 days since your symptoms started. We do sometimes use a test-based strategy, which is then you require 2 negative COVID-19 tests at least 24 hours apart. We usually only use that in situations where somebody lives in a high-risk setting, like a nursing home or a long-term care facility, or might live with individuals who are at risk for some more severe illness, and we really want to confirm that they don't pose a risk to others before we release them from isolation. The close contacts that we identify are placed in quarantine. So close contact is defined as anybody who you've been within 6 feet of for at least 10 minutes, again, while you have symptoms or in the 48 hours before you have symptoms. So most often it's family members, sometimes it's coworkers, sometimes it might be people who came over for dinner or something like that. So it does, it's not just walking by somebody, it is really fairly sustained, at least 10 minutes of being in pretty close contact within 6 feet of somebody else. Those people are issued quarantine orders, meaning that they have to stay home and away from other people for 14 days after their last exposure. So what this means for childcare facilities, for example, let's say we detect COVID-19 in a child, we'll interview their parents. We will, learn from the parents that the child attends a childcare facility. We will then contact you, whoever is in charge of the childcare facility, and say, there's a child who's been confirmed with COVID-19. We do ask you to close while we do the investigation. It is likely, given the definition of close contact, that any child who was in the room with that case and any staff member who was in the room caring for that case of COVID-19 is likely a close contact, just based on the nature of how things go in childcare facilities, that they're likely to have spent at least 10 minutes within 6 feet of the child who tests positive. And so it's likely that every other child in that room and likely the staff in that room would need to quarantine for 2 weeks, meaning stay at home for 2 weeks in case they do develop illness. If we do determine that the other rooms or other groups in the childcare facility did not have contact with that case, then those rooms can likely open up sooner than 2 weeks. But the room with the case would have to essentially not operate for 2 weeks until the quarantine period is over. Let's see. And then in terms of testing in general, we have recommended that at least the children and the staff members who had close contact with the case be tested. It helps us identify new cases sooner so that we can implement these control measures as fast as possible. It helps us understand if there was transmission in the facility. And so we likely will recommend that. It's of course not required. We would never want to force anybody to get tested. They would still have to quarantine for 2 weeks either way. And so we would talk with you, in depth about how we would do that and how we could make that happen. Let's see. And I think that's probably all I had to say about that. I feel like I'm thinking about one more thing, but can't come up with it. But if I remember it, I will say it later. I think, oh, there you go.
All right, thank you so much, Dr. Harrist. I appreciate that. And so I know that what we've talked about tonight is a lot. So we, of course, want to make this information available to everyone. I know the call is being recorded, right, Becca? Okay, good.
Yes.
In addition to that, I hope that everyone's had a chance to visit our website, but I'm happy to provide the slides that we've gone over tonight, that those can be sent out, and they will have links to some of these resources that I am about to mention here. So we talked a lot about the CDC guidance. We'll have a link to that, as well as a link to the current statewide health order. And of course, keeping in mind that the order that I mentioned does not go into effect until next week. But the current order is on our website. And as soon as the new order comes into effect, that one will be available on our website as well. In addition to that, I do want to mention that we have this childcare guidance document that's available on our website. Again, this is the guidance for the current order, so you'll still see that 25 people mentioned there. But in response to some of the feedback that we received from Becca and others at DFS, we have updated this document. And so if you've seen it before, definitely take a look at it again, because it's updated as of today. And it does include some of those terms that we were talking about, and we've added these frequently asked questions. So hoping that that will be another useful resource for everyone, so we can make sure that you have the information that you need. So with that, I think that, let me get back to the presentation. I can't get back there for some reason. But in any event, we will provide these resources out to the group. And I think at this point, Becca, we're ready to take some questions if there are any waiting for us in the chat.
Yes, and there are a couple. I think one of the things on everyone's mind that hopefully you both can speak to is the use of masks. And so I know there's a line in that guidance that you have up right there, Stephanie, and I believe in the order as well, but I know there's been a lot of confusion around recommendation or requirement or how facilities can best use masks in this situation.
Right.
Sure.
Go ahead, Allie.
Yeah, thanks for that. That's a really good question. We really do encourage face masks as much as possible, but we recognize that it's just not possible to wear them in all situations. They are not recommended for kids under 2 years old at any time because of the potential risk of suffocation and the fact that they can't really communicate if they're having issues with the masks, and so they should not wear them. If older children can wear them, it's great, but I recognize the difficulty that there is in asking a 3, 4, 5, 6-year-old to wear a face mask continually. As much as staff can wear them, I think that that's fantastic. I also recognize that it's just not possible 100% of the time. You know, especially for children, you know, who might feel some anxiety, you know, seeing their child care provider wearing a face mask. So as much as possible, but they are not in the orders that they are required for child care facilities, but would certainly encourage them. What the masks are for is that they're actually to prevent you, if you have COVID and don't know it, from transmitting it to somebody else. The types of face coverings we're talking about in childcare settings and in most, you know, public settings that aren't healthcare settings don't necessarily protect you as much from somebody else, but would protect others if you're wearing them. But they aren't, they do provide a lot of protection, but they're not 100%. It's not the same as a healthcare facility mask that providers use to ensure that they're not getting infected. And so I did see a question come through that yes, even if you're both wearing face coverings and there is an exposure there to a positive case, we would still need to do the quarantine as we usually do. I know that's frustrating to some people because some people then ask, well, why do I even wear it? Well, it prevents you from it reduces the likelihood that you'll actually get it, but doesn't completely eliminate it, which is why we still do the quarantine. So hopefully that's helpful.
Another question, and maybe this is more of a clarification too, is that the guidance talks about childcare, which I think many of us have in our minds as this organization or entities that serve children birth to 5, especially working families. But for this context, Dr. Harrist, is it broader, so we're talking not just about childcare in the sense that we think about it, but really about youth-serving organizations who are providing care and education for older children as well. So can you clarify who all fits into this childcare bucket?
Well, I think, you know, in terms of the answer for older kids, I mean, I do think it's easier for older kids to wear face coverings and would encourage them to do it as much as possible. When we have written orders for schools, et cetera, operation, and, you know, we require face coverings when people are within 6 feet of each other. If they're staying 6 feet apart, then they don't need them. So I would think that the youth organizations could follow the same guidance as that, is really encourage the face coverings if people can't be far apart from each other. With the exception of sports, I don't think it's a good idea for kids that are doing strenuous activity to be wearing face coverings.
Okay, and just for clarification on general guidance, will those, you know, youth serving organizations, summer programs, do those fall into the space of looking at the childcare guidance or the K-12 guidance? They're in sort of this strange, like not clearly defined space.
Yeah. I would look at both and sort of incorporate what makes most sense for them, given the services that they're providing and the activities that they're hosting. And you know, CDC does link them together, and I think provides pretty good guidance for both K through 12 and childcare. So and youth sports, and so they may just have to kind of look at a few and take what seems to work best for them.
Great. There is a question too about, again, in this space of a positive case. So wanting some guidance about what happens if a parent of a child who attends a facility tests positive. What is that process or consideration?
Sure, that's a great question. So if the parent tests positive, then the child would obviously be a close contact. And so that child would need to stay home and out of daycare for at least 2 weeks. It would be longer than that because we start the 14 days after they've last had contact with somebody who's infectious. So understanding that likely the parent won't be able to completely separate from the child, they'll have to wait till the parent is no longer infectious and then start the 14 days. So it could be quite a while that the child is out. If the child wasn't sick when the parent was diagnosed, we wouldn't consider there to be any exposures in the daycare itself. If the child did become sick, or we found that the child did have symptoms at the time we diagnosed the parent, there potentially were some then exposures at the daycare, and we would, we would take the actions that I mentioned before.
Some of the next questions look at guidance that might be affected. So thinking about this what might happen on June 15th. And so there are some questions around if parents will be able to enter the building at drop-off, assuming they maintain that 6 feet of social distancing from others outside of their family.
Yep, that's the purpose of the new orders, is to allow that. We've certainly heard from some facilities that making staff come out to pick up the children could actually increase, sort of you may now have a staff having interactions with children from multiple classrooms versus just one. And so certainly if childcare facilities prefer, they can stick to the method that we were requiring before. But if it's easier for them to have the parents come in and drop kids off and pick them up, that is now fine. It is required that parents don't interact or don't get within 6 feet of other kids. And we would prefer that they don't really get within 6 feet of anybody, that in case they are positive, that's going to reduce the exposures and really encourage them to, essentially as quickly as they can, drop their children off and pick them up and leave and not hang out in the classroom for too long. That's just going to reduce exposures if the parent did end up having coronavirus.
Okay, great, thank you. And a couple of more that may be affected here shortly. There was a question about whether or not field trips will be allowed or advised in the next few weeks.
Yeah, so I would think about a couple of things when you're thinking about field trips. One is, how much control do you have over the environment? So all of the really, careful and cleaning, et cetera, and precautions that you're taking in the daycare or in the childcare facility, can likely, if you're going to some certain places, you're not going to be able to control that setting, and the risk might be higher. But if you're, thinking about things like outdoors, going for a hike or a walk, there's probably not more risk there than staying within the child care facility. So I would just think about the setting, how much control you have over both the hygiene and cleanliness of the place, as well as how much control you have over whether there's going to be crowds and whether there's going to be close interactions between your kids and the staff that you might not be able to control. There's nothing in the orders that says you can't go on field trips. We say they're not encouraged. So I would just think carefully about those factors when you're thinking about field trips, as well as transportation. Likely again, the kids in a classroom are all in close contact with each other, so you're not necessarily increasing contact if you're transporting them in a bus or another means of transporting them. But So I think it's more just the place where the field trip is going to be and how much control you have over that environment.
Okay, and then another question about whether or not volunteers will be able to be in facilities, understanding, of course, that they'll be subject to other requirements, but just thinking again about others who may be coming into that facility beyond staff.
Yeah, I think the same, sort of the same answer, that there's no orders prohibiting volunteers. Certainly any additional people that you bring in could potentially increase the risk of somebody having coronavirus. So I would think of it as a risk benefit. You know, are there certain things that you can't do without the volunteers that it makes the potential increased risk worth it? Or, you know, are you doing okay without the volunteers and it might be best just to not have any? So I think really an individual decision for each facility.
I saw, Stephanie, that you popped a link into the chat box on the CDC's guidance for screenings, but we've had some questions about screening both for staff and for children. And so what that screening looks like, I imagine that guidance probably covers some of that. I think there are particular questions around temperatures and taking temperatures and keeping a log of those. So the answer might be, Stephanie, that people should look at the link to the guidance and that will help clarify or offer some options, but there are questions around that as well.
Sure. So the link that I provided is actually the screening tool that we have at the Department of Health. And we put this out for employee screening, but certainly childcare providers can look at this as well. And so I think, Allie, the question is on whether or not, I lost the question now, Becca.
Taking the temperatures of children and staff upon entry or arrival.
So I think, and correct me if I'm wrong, Stephanie, that we don't require that temperatures necessarily be taken. It's more of a verbal screening. Obviously that you can't ask a kid if they have a fever, but ask their parents if they have a fever, and then screen for the other symptoms that Stephanie listed on the slide with CDC listed symptoms. And I just would like to emphasize that we can't one of the reasons I don't emphasize too much actually taking temperatures is because it does create some close contact there where some might not have been otherwise. But also, fever is, in Wyoming at least, we see fever in less than half of cases, and kids especially seem to have milder symptoms than some adults. And so just reliance on fever itself, we want to make sure to be broad and look for all the potential symptoms of coronavirus. So, but yes, still verbal screening, certainly can take temperatures if you want to, and records are still going to be required.
And on a related note to that, Dr. Harrist, one of the questions and perhaps biggest ambiguities around working with in particular young children, but also extending into those youth ages, comes around this idea of it's allergy season. My child has a cough and a stuffy nose and we're teething. So do you have any guidance around what it looks like for children to be exhibiting some symptoms, but not all? Should they be tested? When can they return? I think we've all been clear that people who are sick should stay home. And that, of course, works really well for everyone except the parent who has to miss work for those days. And so I think just providing some clear guidance to this group so that they can articulate what to expect to parents who may not want to hear the message, but need it reinforced and understood as we all move forward through this together.
Yeah, I know that's a really tough question because it's not uncommon for children and adults, honestly, to exhibit some of these symptoms. I think in our screening tool, we're really careful to say, not due to another cause. And I think somewhat it depends on the individual child. If this is a child you know that they show up every spring with or fall with allergies, and it makes sense. I think that that's reasonable. I think if you're not sure, I would err on the side that they may be sick, and just because of what we talked about, what will happen if the child does have coronavirus, there's a lot of implications for everybody else in that classroom, and a lot of potential for people to get sick. I think that, asking the parents to see or talk to their healthcare provider, and if the healthcare provider can provide some, yes, my clinical, we're not expected to be clinicians here. You guys aren't expected to be clinicians. My clinical judgment is that this is allergies. I think that makes that then would be okay. I think sore throat is one of the symptoms that's listed. I would certainly send a child home with a sore throat, but if it's diagnosed as strep and they've, taken the 24 hours of antibiotics and they're safe to come back, well then, and the doctor says that they can come back, or the healthcare provider, then I think that's, that's reasonable. So I would really err on the side of caution in this. I know it's hard for parents, but I think that they understand too that they don't want potentially to have to shut down a classroom if their child does have coronavirus. It shouldn't be up to, you guys, whether somebody gets tested. It should really be, please talk to your healthcare provider about this and let the clinician sort of help with those decisions. I did see a question there too about how long, a child with symptoms but they're not tested should stay out. The answer to that is the same as our isolation criteria. So CDC recommends that anyone with compatible symptoms essentially stay home for until 3 days have passed since their fever resolved, until their respiratory symptoms are improving, and until it's been at least 10 days since their symptoms started. That way, if it is coronavirus and they don't get tested, you're providing the same level of protection. Of course, if they see a healthcare provider or consult a healthcare provider and the healthcare provider says that, this is not coronavirus, they're not infectious, they can go back earlier, then that's reasonable for them to come back earlier. But otherwise, they should stay out for as long as we would keep them out for coronavirus.
Great, thank you. There was also a question about when to use gloves. So do you have any sense of gloves versus hand washing, or what protocol is there? Perhaps the CDC does?
Gloves, essentially, for food service, I would follow the food service guidelines that you normally have. As long as frequent hand washing is going on, then I think that they're, that's as effective as gloves. So either one. If gloves help you remember not to, touch your face or, remind you that you have to, be careful, then that's a good strategy for you. But if you can really be good about hand washing and hand hygiene, that's usually just as good.
Okay. And a question about the length of the virus and its life on surfaces.
Yeah, that's a very, it's a question and we still don't have the answer to. There is certainly a possibility that the virus can stay on surfaces for several days, which is why that we recommend frequent cleaning. It likely, the time that it lasts is likely different based on the environment. So we do expect that it would last longer in sort of indoor environments than outdoor environments, especially here in Wyoming where we get a lot of sun and wind and no humidity. But, I would assume that, that's why we recommend the frequent cleaning, is because of the potential for it to last on surfaces. Still, the primary mode of transmission is person to person, but because of that risk of transmission from surfaces, and especially in a childcare setting, where things go in mouths a lot, that would increase the risk.
I know one of the questions that you touched on earlier to Dr. Harrist or Stephanie, one of you talked about sanitizing and disinfecting, but for the sake of all of us, can you just define, I know there's a difference between sanitizing and disinfecting, and there's been some confusion around when to sanitize and when to disinfect, and I think you covered some of that, but I think it's helpful for all of us to understand that we say cleaning, sanitizing, and disinfecting because those are three different and necessary processes. So that may be another one of those terms to provide some clarification on.
Sure, and I'm taking this directly from the guidance that CDC links to from the Caring for Our Children document, which is a really great one. I encourage people to look at it. And it literally says the same, it gives a definition. So it defines sanitizer as a product that reduces but does not eliminate germs on inanimate surfaces to levels considered safe by public health codes or regulations. So sanitizer is usually what's recommended for use on surfaces that would contact food, toys that children may place in their mouths, and pacifiers. While a disinfectant is a product that destroys or inactivates germs on an inanimate object. So the way I think about it is sanitizing is what you want to do for things that are likely to go in our mouths, because it's a little bit safer for us, whereas disinfecting is sort of that next step that you can do for the surfaces that are not as likely to go into our mouths. And so what I really would recommend is any product that you have is really looking at the labels and using it according to the instructions. It should really say what it's supposed to do in terms of sanitizing or disinfecting and how best properly to use it, whether it needs to be rinsed before you can then use it to eat off of, or whether it can then be used as a toy that could potentially be put in somebody's mouth. So really just encouraging reading those instructions as thoroughly as possible.
Great. Another question, I think we touched on volunteers, but there was a question specifically about having volunteers with therapy dogs come into a facility where there may be more of an indoor interaction than an outside space where you might have volunteers.
Yeah, and I would give the same sort of risk-benefit answer as I gave before. I worked in a hospital and I saw how important those therapy dogs were to the patients there and how much of a difference they made. So I think that, again, any new person you introduce there's always sort of a risk of now introducing coronavirus. But if it's really if it's important for the kids to do that, then I think it's worth considering.
Okay, thank you. Now we have some questions about play spaces. So indoor play spaces, if they're sanitized, or what are the guidelines for those? Indoor play systems or spaces, and then one about public playgrounds, but we can answer those together or separately.
Sure, so I would say the indoor play systems, yep, I would use sort of the same procedures that you use to clean the other parts of the childcare facility, and just read the instructions on both the cleaning product and probably the play system itself for what's the appropriate substance to use to clean it. I would, yes, recommend cleaning it at least daily, if not more. Potentially could consider cleaning it in between groups of different kids. And yeah, I mean, smaller public playgrounds are, it's sort of that risk benefit. You have less control over maybe how clean that place is, but also not very likely that the virus is going to be surviving outside for long periods of time. And especially if there aren't other kids there and you can make sure that people aren't having close contact with each other, then I think that that's a reasonable thing to do in a way to get kids outside. I would, take extra precautions with, having them clean their hands, before eating and before putting it in their, touching their mouths and eyes if you can, although I know that's difficult.
Okay, and a question now about the recommendation of HEPA filters for the classrooms or blue light sanitizing.
Those are good questions. I don't believe that there's any evidence to support the light sanitizing, but I will have to look that up. And same for HEPA filters. I would think that they are recommended, but I will have to look up that information. I apologize.
We had a couple of more questions around positive cases and closures. So in particular, how a negative test affects someone's ability to return. So if we're within that quarantine period of 14 days and there's a negative test, is that enough, or is it the full 14 days?
Yeah, we get that question a lot, and unfortunately, the term we use is you can't test out of quarantine. And the reason is that because you could test negative at day 3 and negative at day 7, but still could possibly develop infection at day 13 or 14. That incubation period, while it is usually more along the line of 5 to 7 days than 14 days, it can be up to 14 days. So unfortunately, a negative test can't get you out of quarantine. You do need to do the whole 14 days.
There's another question about screening for staff and children and what needs to be included in a record. So I don't know, Stephanie, if that was part of, I haven't looked at the link that you popped in the chat box, but is there kind of a form or a template for the sorts of information that need to be recorded, presumably, so if there is a positive case, there's a record
Right.
to help
So
trace. Show
on our
information.
screening document, I don't think that we've ever created an actual form. Allie, do you recall if we've created a form? I don't think we have. So I would say just capturing the items that are part of the verbal screening that we've talked about, you know, in a record that it was done, but we haven't created an actual form for that.
I believe their forms exist, you know, examples of forms, but I agree, sort of, you know, the name of the child, the time, and the results of the screening would be sufficient.
Another question came in about the length of orders. So you mentioned a new order will be released tomorrow that takes effect on June 15th. Do you have an anticipated length of that? We know things are changing moment by moment, but I think some hope for certainty perhaps, but if not, we'll take it.
Yeah, so the orders have been going for 2-week periods, and that is because it does correspond with the incubation period of the virus, and it gives us a chance to see any effects that our orders might have had before we decide whether we're ready to take the next step. I will sort of say for daycares that the intention, again, starting on Monday, was to return to normal as much as possible. I think that, you know, the enhanced cleaning procedures and screening procedures that we're asking you to do now will likely be a long-term thing, honestly. And so I don't expect that we're going to see a lot of changes in the orders, at least for childcare facilities. Even if the orders sort of go away as we know them, I think the recommendations for the practices that we're requiring right now will likely continue according to CDC guidelines. But as Stephanie said, things do change fairly rapidly, and if we learn more things, and if CDC comes out with different guidance, or we think the different guidance is appropriate for Wyoming, we'll of course implement and let everybody know.
Great. I think we're wrapping up on questions, I do believe. And so what I will invite others to do is just continue to think about questions and respond via email. One of the questions that I actually felt more prepared to speak to than either of our wonderful panelists from the Department of Health was a question about funding. So I want to speak to that quickly and then see if anything comes in. But you know, there are a lot of questions about how child and youth serving organizations are able to pay for the additional cleaning supplies, the time that it takes to do this work, knowing that we're still working toward capacity. Families have had a lot of changes. There have been changes in family circumstances. So we know this is both a financial burden and a staff burden. And so there are a lot of questions about funding opportunities. So a couple of items to touch on there. The Department of Family Services received dollars through the Federal CARES Act for the Child Care Development Block Grant, and the significant majority of those dollars will go directly into facilities. And in particular, we're talking about licensed child care facilities or licensed and exempt child care facilities. So I hope that that means many of you on this call will be affected by those dollars. Some dollars will go out through a direct payment that all licensed facilities will receive. And then Wyoming Kids First will also run a grant program for licensed and exempt facilities. Very simple application to apply. We'll be releasing details on that here in the next week or so that you can all be prepared to ask for additional dollars. And that way, those dollars can be used broadly to support lost revenue, to support the increased cost of supplies and materials, to change out some of your classroom equipment and supplies to better accommodate some of what you're doing now in a classroom. All kinds of opportunities as it relates to response and recovery from COVID-19. And then we also want to note that yesterday, today is Tuesday, so yesterday at 10 a.m., the Wyoming Business Council opened their applications for their business interruption stipend program, and small businesses with fewer than 50 employees are eligible to apply for those stipends to help recover some of the lost income and other expenses that have taken place during this challenging time. So we're happy to connect you to additional resources in that sense. And so if anyone has any questions, you're welcome to email me about those, and we can stay in touch and hope that we'll get those dollars out to facilities sooner rather than later. And so we'll keep compiling a list of questions, but I think we've we have another one here. If a parent who has been exposed refused to get tested, how long should that child stay home?
Yeah, you can imagine sort of 1,000 different scenarios that could happen, and I feel like we've seen them all, but I'm sure there'll be other ones that come up. I think the main thing I want to say is we're not expecting child care providers to determine, who can come to the facility and who can't. When we do the investigation, or when local public health does the investigation, we will make those recommendations for if we consider somebody at risk for being exposed. In general, if let's say that I have an exposure and my best friend who I've been in contact with has been in contact with me, but I'm not sick, that other person, or who we call a contact of a contact, is not considered to be at risk. And so if a parent has a potential exposure and they're in quarantine, technically the child doesn't have any exposure if the parent isn't sick. But we will work through all of those details and consult with you and give you what our recommendations are for each individual type of situation, because there will be many that aren't always crystal clear.
We do have a question that I think is a relevant one about if people have specific questions after this webinar, should they call their local health departments? What should be their contact with all of you or with us? So do you have a sense of what moving forward and additional questions look like?
Yeah, I think that the first call would be if it's about coronavirus, is to the local public health office. I think many of them will be able to answer most of the questions, and if not, they can always either consult with us or they can have you contact us. But certainly if you're feeling like you can't get an answer or you're confused, you're always welcome to contact us as well.
Okay, so I know we're still getting some questions in that chat box, and we'll continue to monitor those. Please feel free also to just stay in touch, but I think we'll look at wrapping up or having any last comments or thoughts from our panelists. And I know Michelle and I may mention some opportunities that are coming up that we hope more individuals will engage in as well. So I'll ask Dr. Harrist or Stephanie if you have anything to add before we wrap up.
I just want to say thank you to all of you. I mean, you guys, I know have been providing services this entire time and have really been on the front lines. I appreciate your patience with us. We're learning as we go, as are you. And so, appreciate any feedback that you have that we can make our activities better as well. But just thank you for all that you're doing and taking care of our Wyoming children.
Yeah, I would just echo that. Thank you all very much for the work that you do and, for walking through this with us. And we're always here as a resource. So please feel free, your local public health nursing office is a great resource. and we're happy to help as well to the extent that we can. You know, we're here, and we're here working for you. So thank you all very much.
Great, thank you both so much. We can only imagine how busy you are, and so we know this is a gift of time for you to be here and answer these questions face to face. And we, again, will note to all attendees that we will be sharing the recording of this, and we'll get that PowerPoint from Stephanie and make sure that you have this as a resource. We'll continue to monitor your questions and provide as clear guidance as we can. I know that a small team of us, including individuals at DFS, will be working to make sure that we're providing clear guidance and support for all of you during what we know are challenging times. You are providing critical infrastructure and supports for families and communities. And so I echo the thanks that has been shared for the work that is happening both at the Wyoming Department of Health and the governor's office to consider the health and well-being of so many citizens, and then also to all of you who are in the field providing care and support and education for young children, youth, and their families. So it's great work and a tenuous balance, but I know we'll continue to muddle through it together. So I say again, continue to share your questions. We'll continue to work to get clear guidance and work on this together. There will be some additional opportunities that are up and coming in addition to the funding opportunities that I spoke about, which I'm sure everyone will be quite delighted by. But there will be some advocacy opportunities where we hope to hear from you. I know we've been sending out surveys and asking a lot of questions, and we do appreciate the time that all of you take to share your insights and your needs and your conditions and situations with us. It really does help us at the advocacy level. So look forward to some additional opportunities in that space, and I'll ask Michelle for closing comments and opportunities as well.
Yeah, thanks everybody. I just also want to just express my gratitude to everyone, especially at the Department of Health, for everything that you're doing, and all of you who are with us to really help kids reach their full potential. One thing I just wanted to mention is that the Afterschool Alliance has put together a summer activities guide that will be coming out every 2 weeks. It's developmentally staged all the way up through high school. It's been developed by a team of people working around human development to really focus specifically on social emotional skills as well. And it can be delivered either with light touch packets or online. It's all been designed to really help each of you support kids over the course of the summer. And it's available for free to anybody who would like to access it on our website. So please take advantage of that. It's something we've done in collaboration with other states really to serve young people. So that's the one thing I wanted to just offer as a positive combination, and thanks to everybody for your time tonight.
Yes, thank you all. Enjoy the rest of your evening.
Good night.
Thanks everybody. Bye.